Hello, my name is Glyn Butcher. Thank you for inviting me to come in to speak at the Doncaster CCG AGM today. I'm really excited about what I've got to say and about being part of this day. I just want to say I've been in mental health services for over 30 years myself as a service user and even longer as a carer for my mum with schizophrenia. I'm a member of the People Focus Group, that is PFG, where it's better known as, based at Montrose Avenue at Intake. Our tagline is Get a Life, Not a Service, and it's been in existence for over 10 years. It's based on peer support, which means people helping people. So Safe Space. Safe Space was a pilot in 2019, April 2018, using the winter pressures monies that was available at the time to see and listen to people about what an alternative crisis service would look like. It was commissioned fully in December 2019, 19th of December, because we wanted to run it before Christmas, because we know Christmas were a bad time for people with mental health problems. So that's when it came about. The referral process for Safe Space. Safe Space is not self-referral. Everything has to go through the single point of access. Telephone number 01302 566 999. That's to enable the crisis service to triage people so they get the appropriate service, and also to safeguard peers and staff. The purpose of Safe Space is to enable people with mental health conditions to manage their social problems and their long-term conditions more effectively. Through Safe Space, our partnership working with agencies throughout Doncaster has vastly improved. Our relationship with Ardash has blossomed, and it has created a new culture, a shift in the culture, and a greater understanding of each other's role through the SPA team that we didn't know before. So the understanding and the respect for them has greatly improved from all sides through peers that work on Safe Space. I think the number one impact on Safe Space so far, as on the community and on the public, is that it's saved lives. It's reduced suicides. It's reduced hospital admissions to A&E and to St Cath's. It's also reduced antisocial behaviour in the community, where people would normally carrying out and acting out within the community. They've got somebody to talk to about the social problems that they've been experiencing. So it's reduced people taking drugs and alcohol or using other negative coping strategies or coping mechanisms to handle the emotions and also to handle the things that's happening in society today. No one could predict COVID-19, and it's had a negative impact on our service with the amount of calls we've received. Can I just point out, all the way through COVID, Safe Space has been open. It's never been closed one day. Between December and April, we averaged 250 calls on a month. In June, it jumped up to 700, more than doubled. And again, in July, it jumped up to 850 calls a month. Now, these are new people. These are people that are not known to services. Some are, but a lot of people aren't, through the effects of COVID-19. Some of the people that are phoning now are people who are experiencing domestic abuse. We have experienced a lot of people with domestic violence. We are experiencing a lot of people with trauma problems through COVID-19 and being triggered through not seeing family and friends and loved ones and carers and children. We've seen a lot more elderly people. One of the things I wanted to raise, which is unusual about a service, is that Safe Space attracts a lot of men. We're not sure why that is. We get a high proportion of men who wouldn't normally come into a service. PFG's hope for the future is that our relationship with Doncaster CCG continues growing from strength to strength. Also, the same with our partners. Another hope for the future is that Safe Spaces are based in every community throughout Doncaster, run by peers, and that PFG leads the way in training people up and learning people from the lessons learned that we've learned through creating this safe space. Another hope is that the funding for safe space continues, and that it is part of any strategic plan that's created through the NHS, CCG, DMBC, R-, etc. And it's part of a pathway that stays forever because of the good work that it provides. I'd also like to say that without your commitment and without your support, none of this could have ever been achieved. I'd also like to thank Stephen Emerson and Michelle Clark for their unwavering support for our safe space and helping us to create something for everyone, because Doncaster for everybody is not just a few. And I'd also like to have a special thank you, and I'd like to mention the leadership throughout CCG. None of this could have happened without the strong leadership that CCG has. So I'd like to thank Jackie Pedersen and also Dr. David Crichton for their unwavering support and their strong leadership to make things happen, who are truly pioneers in this field. Thank you. Bye.